If you can take your seats, we're going to get started. According to my watch, we're running about 3 or 4 minutes late, so we don't want to cut into the dean's time to talk about this important issue. My name is Don Wilhite. I'm a professor in the School of Natural Resources at the University of Nebraska in Lincoln. Some would blame me for this whole thing. I was one of 4 authors for the UNL climate change report that was published in September of last year. And there's been a kind of a groundswell of interest in this topic of climate change and its implications for Nebraska that's evolved since that time. The number of grassroots organizations that have become engaged in this conversation. It's not that they weren't engaged before, but I think the report helped to crystallize in a lot of people's mind not only what they're seeing that's happened up to this point, but where we're going from here. And so this event today and tomorrow will be followed by a roundtable discussion, is actually part of a series of 8 roundtables that we have organized. We are completing today or tomorrow. We will have had 5 of the 8 roundtables completed. The first one was focused on sort of the role of the faith community in terms of addressing this particular issue, and with the Pope's encyclical and other issues regarding the faith community, this has been a topic of major discussion. That was followed by one that focused on urban and rural communities, and so that was organized by the City of Lincoln, working with the Rural Futures Institute at the University of Nebraska. Then we've continued to have others, one that focused on college campuses and what they can do in terms of adaptation mitigation strategies. Today in Lincoln, we had one focusing on ecosystems and wildlife and mitigation and adaptation strategies associated with that. Today, we're beginning a roundtable discussion focusing on human health and the implications of climate change for human health. Next week, we're doing one on forests and fire. Then we'll do one on agriculture, food, and water. And the final one is going to focus on energy management, energy availability, and so forth. So this is part of a series which we intend to package and publish as a report once we complete all 8 of these roundtables. The hope is that the legislature is actually going to take this issue up in terms of a climate action plan for Nebraska and start some discussions about that next January. So we'll keep our fingers crossed and we'll see how far that moves forward. We're delighted today to have Dr. Khan giving us a presentation. You see the title of his presentation, Public Health Heats Up, Global and Local Impacts of Climate Disruption. I think many of you know Dean Khan. He's retired Assistant Surgeon General with the U.S. Public Health Service and Dean of the UNMC College of Public Health. He's been working in the area of emerging infectious diseases, bioterrorism, and global health security for many years. I think we are fortunate to be able to attract him to UNMC after his retirement from his previous position. And so please join me in welcoming Dean Khan.
Thank you for that very generous introduction. Good afternoon, everybody, and welcome. I must say, I think I'm the one who was fortunate to be able to come here to the University of Nebraska Medical Center. So it's a good time to talk about climate change, especially since what we've been reading about extreme weather events. And while you cannot point to any specific event to say that this is extreme weather due to climate change, as you look at it cumulatively over time, you need to start asking questions of whether or not these increase in events that we're seeing is really due to climate change. I got into the climate change business 15 years ago, and I came into climate change from a very different angle. I came into it from an angle of Rift Valley fever. So this is a mosquito-borne disease in West Africa, and based on remote sensing, you can actually predict when you're going to start seeing cases occur within animals and occur within humans. So that sort of catalyzed my interest, and I was involved in CDC climate change talks. And this is a slide I've been carrying around with me for 15 years, almost 15 years, where I would just sort of beat on the table and say, look, we're seeing the effects of climate change today. And these are 4 specific diseases. Cryptococcus gattii is a fungal disease. That's a tropical fungus that's for some bizarre reason showing up in Vancouver. We're seeing oysters get infected in nice cold water in the Northwest when they're not supposed to. We're seeing an expansion of tick-borne encephalitis in Scandinavia, and we've seen shortened cycles for a respiratory disease amongst kids. Very old slide. And the science has moved, as I've gotten back into this over the last year or so, the science has moved dramatically as we think about climate change and what the impacts of climate change are in our communities. So this is the last slide I personally made. So for all future slides, I need to thank my wonderful MPH graduate, who's Kathleen, I don't see her here, who made all the additional slides. And for those of you who've not had the wonderful opportunity to work with or hire a graduate of our school, check out the work that she did on these slides, okay? That's the type of people we produce here at the College of Public Health. So I'm going to start with the science first. Just a quick snapshot of the Intergovernmental Panel on Climate Change, their 2014 synthesis report. And you can read faster than I can speak, so I'm going to leave you to read these 2 quick quotes about warming of the climate system, which is unequivocal since the 1950s, and the fact that this is anthropogenic greenhouse gas emissions that have caused this to happen. The important thing about the IPCC is really the box underneath it, which is, this is, 217 authors representing 92 countries, 242 lead authors, 436 contributors, etc., etc. This is the scientific consensus. And this is actually, so if any of you have ever put a group together of 3 to 5, I challenge you to put together a group of 242 people and agree on anything. Okay? So this is, by nature, the absolutely most conservative view you could possibly get, where you got all 242 people to say, and 195 countries that signed off on this to say, okay, the data is so unequivocal that I can't say boo to this. So this is baseline, without a doubt, what's going on. And yet, it snows. And it's always good to remember that there's a difference between climate and there's a difference between weather. So even though the world is warming, we're not saying that it's never going to snow again. The other thing that we need to remember is climate is, irrespective of what we may or may not currently be doing with climate change, climate has always been changing, right? You've seen the videos, the TV series about the world beginning, and you got these volcanoes out there, and it's bubbling and it's hot all over the place, and you have ice ages. So we know climate has always been changing, and that's not going to become any. Let's see, do I got the little pointer thinky yet? So, this is over hundreds of thousands of millions of years as you look at what the climate has done over time. And you'll see, actually, why there's often some confusion about previous predictions that it's of a new ice age is the natural pattern for our planet, if it had the way it wanted, is actually an ice age. It's actually the natural state of our planet. So we're very lucky for this whole warming period that's led to the last 10,000 years of civilization. Big fan of warming, but not a big fan of the increased warming that we're seeing now. And that's really affected the greenhouse effect. And for those of you who may not read and see this every day, essentially what greenhouse gases do is they act as a lovely jacket, and they make the planet warmer. Where do these gases come from? All over the place. Here's some great examples here. But burning of fossil fuels is a key component of where those greenhouse gases come from. And if you look at the annual greenhouse gas index, what you'll see is the major greenhouse gas that's going up. This is CO2 right here. And you'll see some increases in methane here and other components of what people ask you what are greenhouse gases. This is us. Okay? So in, what is this? In 650,000 years, CO2 has never been above this line. So this is where we are now. So current CO2 levels are 400 parts per million. And the dramatic shift, obviously, has been since the 1950s and what we've seen in CO2 increases. And so this increase in CO2 is having profound effect on our climate. And what I'll show you is a couple of quick slides looking at temperature, sea level, and snow cover. But what's unequivocal is that warming. 2014 was the warmest year ever on this planet. Not ever on this planet, but that we could tell in the last 620,000 years or something such like that. It was a very hot year, 2014. Here's what global temperature has looked like since the 1980s. You can see the increase. Here is the decrease that we're seeing in Arctic snow caps. And we've seen an 8-inch rise in sea levels since 1880. So this is, the data we have now, unequivocal data from warming. And with that sea rise, doesn't take much to project what happens to coastal areas and small Pacific islands if we continue to see this increase in sea rise. I always like to talk about I'll talk about health effects, but I always like to talk about some of the ecological effects that we're seeing today. So I often get asked about climate change in the context of, Ali, are you worried about something that's going to happen in 40, 50, 100 years from now? And I go, no, I'm worried about stuff that's happening today, that has been happening for the last 2 decades or so, if you're really careful to look at what's going on. And frogs are my favorite, because they, you use the term, we use the term canary in a coal mine. Frogs are the equivalent in our ecologic systems of canaries in coal mines. And I'm not sure if we have any ecologists in this audience who can verify that approach, but that is what I've been told by my ecology friends, and they're also kind of cute. We see market declines in various parts of the world, physiologic changes in toads and what proportion are female and male, and complete toads sort of disappearing. So we've been seeing this for 2 decades as sort of that, hello, pay attention to what's going on in your climate. But we're also seeing changes. This is another part of that ecologic change I always like to talk about, is bird migration. And I think a little later I'll talk about frost-free days and when the spring begins. So if you're a bird who's been genetically programmed to show up at a certain time of the year every year, because that's when the food's going to be available, and guess what? It's still, it's too hot, it's too cold, whatever the situation may be. Not a good thing, right? It's not a good thing that's going to happen. So all of these changes in migration have massive impacts on our birds. And there's this concept out about planetary boundaries, has a way to think about what do you need to perturb before you just shift the planet into a completely different state. And the data suggests that we've reached 4 of those planetary boundaries in terms of land use, climate change, biosphere integrity, and biogeochemical flows. So this is how phosphorus and nitrogen move throughout our climate. So we're really getting close to the point where we essentially have a complete shift in the ecosystem in a planetary ecosystem. And climate change is considered to be one of the central or core determinants of these planetary boundaries. So when you sort of take all that evidence and you put it together collectively, what you have is a 2 degree Celsius increase in global temperatures inevitable, even if we take dramatic action. So this goes back to climate change is now. So what we're not talking about is how do we prevent climate change? How do we prevent global warming? It's happening now. It's a done deal. What we're really talking about, or we will be talking about in the Paris talks coming up in December, is how do you make a decision between, do you want your world to increase by 2 to 4 degrees, or do you want your world to increase by 8 to 10 degrees? And all the various different impacts on what choices we will make as countries on how warm we want our world to be and what those ecologic, social, political, economic impacts are going to be. But what I'm going to focus on is what are the health impacts likely to be as we think about climate change in our communities. And I want to give a shout out to the lovely report out of UNL to say this isn't, I think it's always good to have data that says this matters to us here in Nebraska. So yes, this is a global phenomenon, but at the end of the day, all global are a function of what local issues are, local phenomenon. And so this is a synopsis of the UNL report, Understanding and Assessing Climate Change. So we, like the rest of the United States, have experienced about a 1 degree Fahrenheit increase since 1987, and you can read through sort of the implications of that, including the length of frost-free seasons and what the projected changes in Nebraska are likely to be. So do you get to choose 4 to 5 degrees, or do you get to choose 8 to 9 degrees or more by the end of the 21st century? Okay, now before I talk about health effects, we have a small enough audience. If any questions? Okay. Am I going too fast? I'm a New Yorker. The more excited I get about things, the faster I talk. So I will probably do my 100 slides in a good, 30 minutes. We're okay? Okay. So climate change affects human health in 2 ways. So it changes the severity and frequency of health problems that are already affected by climate and weather factor, and we know those, seasonal diseases, we're all comfortable with that, and then creating unanticipated health problems or health threats in places where they generally don't occur. What I don't have up here, and I think this is confusing often when I talk about climate change, there are no new diseases, that we've never discovered. I mean, we will get new emerging infectious diseases, I'll admit that, but it's not like all of a sudden something out of the blue will show up and say, hi, I've never existed, it's climate change, this is now my time. That's just not the way it works. We know what the conditions are that will impact our health, and then we just need to understand within those, how can we sort of adapt to those diseases, and how are we aware of them, how are we thinking about them in our clinical settings and in our community setting. This breaks every rule of slides, which is it's way too complex, you can't read it, you have no idea what it says, and that was done on purpose, okay? And so this comes out from the recent lovely paper in The Lancet, from the Lancet Commission, looking at what are the impacts of health change. I will not bother to run through all of this for you, but this is to make the point that it is complex. So when somebody says, Ali, we're going to go up 1 degree, what does that mean? It's not a linear relationship. It's an extremely complex situation with various factors that come into play that say, okay, this is what we think is likely to happen. So I show this slide for no other reason to emphasize that complexity. However, to walk you through what some of the health effects are, I'll show a more simplified model of climate change and health effects that talks about the drivers, and we've talked about those, right? Increased temperature, rainfall pattern changes, extreme weather events, and sea level rise and ocean acidification. So these are the climate drivers. These are some of the exposure pathways. There's non-climate stressors on this, what we do with our ecosystems. And then obviously, I always look at this as a public health person through the lens of social determinants and vulnerable populations and what is the impact on them. And then this leads to a series of predictable health outcomes. What are we likely to see as a function of climate change in our communities? And what I'll do is I'll run you down these one by one with you to show you what we could expect to happen. So let's start looking at heat-related illness and extreme weather events. What is the leading from extreme weather events? So put them all together. What's the leading thing that kills people? You get to choose between heat, floods, hurricanes, tsunamis, tornadoes. Heat. Way and far. Heat is the thing that'll kill you. And so even though it would increase global warming, we'll see a decrease in people who die from, obviously, cold-related illness. That will be dramatically offset by yet additional increases in people who we will see die of heat-related illnesses. And again, I mentioned the social determinants and thinking about vulnerable populations. So, the people who are at risk for many of these extreme weather events, including heat, tend to be people at the extremes of age, real young people, the elderly people, and others. And this slide is to make the point of how powerful, even today, so this was 2003. 10 years ago, this wasn't the dark ages, okay? 10 years ago, I know we had electricity. I'm pretty sure we had air conditioners and fans 10 years ago. So this was in Europe. They had 30,000 deaths, okay, from a heat wave. This is pretty profound. Just 10 years ago in Europe, hottest summer that Europe has seen since actually the Dark Ages, when they didn't have air conditioning and fans. So in today's day and age, heat remains a significant issue for us in the United States. And what you'll see here is the projection of increases in heat-related mortality. So this is cold-related mortality. This is heat-related mortality, and based on different models, essentially. So again, this is decreases in cold, obviously, increases in deaths due to heat, and net up. Okay, so heat-related illness is one component of extreme weather events, and these you read about in the everyday, and all the impacts there are from extreme weather events, starting from direct effects from injury, obviously, injury and death, and then all the other add-on effects about water quality, infectious diseases, etc., vectors that come with the extreme weather events. Something we know is associated with extreme weather events are tropical cyclones, and that's associated with increased sea surface temperatures and increased cyclone, obviously, intensity and storms. Rain, this was about a decade ago, 1,000 deaths in Mumbai from mudslides and floods, so another extreme weather event from increased precipitation. And this is to give you globally what we're looking at in terms of natural disasters reported since the beginning of the last century. So easy to see an increase in natural disasters in the last century. There's also a concomitant increase in the cost of natural disasters in the last century. Here was my point about heat waves causing the most death. But this gives you a sense of billion-dollar losses from weather events and what we're seeing in terms of billion-dollar losses. Take this with a little grain of salt, because a lot of this is a function of the fact that hurricanes hit coasts, and people love living on coasts. And so that's driving some of the increase that you see in costs and trying to clean up from those. Let's talk about the next. So when you talk about climate change, people invariably say, got it, heat. But I always like to remind people there's so many other health-related effects of climate change. And the cardio-pulmonary illness is not one that people usually think about. Heart and lung disease is a real significant issue. And this has to do with ozone levels, and this has to do with air particulates and how they affect your health. It also has to do with, I think I'll show, okay. So these are projections for changes in ozone within our communities, including here in Nebraska, and you'll see increases in premature deaths. And we already know there's an increase in premature deaths in people who because of ozone and particulate matters. Here's globally, as you look at exposure to deaths due to increased particulate matters in the air, and what those projections are going to look like, depending on whether you're in the developed countries, the BRICS countries, and the rest of the world. So this is a big problem today. This is a big problem today, and it'll just get bigger over time. Drought also has an obvious effect respiratory illness, especially, and I show this slide to make that point, and I'll probably make this point 6 more times, about what the vulnerable populations are from some of these health-related effects. This is drought, again, has an effect on respiratory illness. Another component besides ozone and particulate matter is allergens, and we actually know, and the data is actually, some of the data was derived right here in Nebraska, showing that you'll see increased ragweed counts, etc. You see increased ragweed counts and other allergens with increased temperature. And so if you happen to be a poor kid with asthma, that's not a really good thing when there's some increased aeroallergens out there and increased heat out there. So you're going to see more asthma attacks. And asthma, so in this audience, I can tell you, if I asked for a show of hands, 1 in 10 of you will raise your hand that you have asthma. It's actually quite a common clinical condition in our population. Although people may miss heart and lung disease, they don't usually miss vector-borne diseases. People sort of get a sense that something with vectors, if you increase temperature, that we need to worry about vectors. And yes, global warming's greatest threat may also be the smallest. And this shouldn't surprise people. If you have vectors, they're going to need certain type of temperature, and they're going to need a certain type of humidity and rainfall patterns. And as those change, the vectors will go, you know what, I'm happier here. And they'll just sort of move where the climatic conditions are happier for them to grow and do what they do well. This is data showing you the distribution of Lyme disease in the United States and what has happened with that distribution over the last, 12 years may look like. I can superimpose this if I looked at St. Louis encephalitis and a couple of other vector-borne diseases. What you'll see is this northern trend for many of these vectors because those climates are becoming a lot more hospitable for them. And this kind of makes sense. I mean, I think that's pretty intuitive. It's also true for lots of other conditions. So this is, again, here in the U.S. This is plague, and sort of a model showing you how, depending on the amount of rainfall and the temperature that occurs within a community, you increase the risk of human plague. And again, this is a complex model that includes the vector, the fleas, the reservoir, the cute little prairie dogs, and you, the people. But again, climate clearly has an effect on this. It's been very nicely documented. We're also able to see changes in distribution of vectors in Africa, and most of this data is derived from Africa and elsewhere, where based on where vectors are actually moving farther up mountains and other areas based on altitude where they wouldn't go before because there's just no snow now, and it's becoming a lot more hospitable to say, you know what, I'm going to sort of trek on up there. And this is probably going to be a bigger issue for things like dengue. We believe that there'll be an increased number of people at risk for dengue because of climate change. Not so much for malaria, from my reading of the literature. And it really has to do with, you need to factor in a couple of different things. Besides temperature, there's also rainfall and precipitation. So let's say you have a complete drought in an area where there's malaria. What's going to happen to malaria? It's going to go away, right? It's going to see no water, no mosquitoes. So you really need to balance those things. But I show both of these, and I'll probably mention it again. It's not every vector-borne disease is going to go up, right? You really need to try to understand what are the dynamics of that disease and then say, okay, what are we likely to see with that disease? And also it takes care of some of the hysteria that, the world is falling. No, as scientists, we need to be a little bit more specific and say, you know what, these are the diseases that you are at risk for. And I think I probably show that in a minute with another set of them. But these are the various vector-borne diseases and their greatest impact. And so we need to consider individually to go down these and think about what would the global impact of any individual disease be based on what the local conditions are where these diseases occur. So that's why that local data is important. And droughts, again, one of those extreme weather events that have a profound effect, especially on West Nile. and what you need in terms of temperature and rainfall to increase West Nile. Sometimes it's counterintuitive. The same thing with hantaviruses, etc. You sort of need a wet year and then a dry year. So it's not just necessarily it's going to be wet, but it may actually be dry and hot is what you need to make the mosquitoes happy. Here's waterborne diseases. A lot of this is a function of extreme weather events and how does altered rainfall change what's in our communities and what's in the water that we drink in some way, shape, or form. Most of this will be driven by diarrhea and diarrheal illnesses as we think about waterborne illnesses. This is an outbreak I helped investigate now, I dare say, over 20 years ago. So this was a cryptosporidium outbreak where there were 400,000 cases and 54 deaths, preceded by the heaviest rainfall in Milwaukee in 50 years. The interesting thing about this is it was picked up by the pharmacists, who all of a sudden were treating a whole bunch of people with cryptosporidium, and then all of a sudden the clinician sort of said, oh, and the epidemiologist said, oh, we have an outbreak, 405,000 cases of an outbreak. And so this was heavy rainfall and leading to a crypto outbreak. This is a little cartoon that sort of shows how various runoffs, etc., can get into your water supply, floodwaters, etc., and impact your own drinking supply. We do know intense rainfall is increasing in the Great Plains. You can see the changes here in heavy participation, and we do also know, and I got to thank Professor Corbin for this slide, water contamination and impairment in Nebraska, and what we're seeing right here in our own state in terms of the impact on the various rivers and streams. Increased temperature also is associated with harmful algal blooms. This is red tide here. And we also know increased surface temperature is associated with increased water contaminants. My favorite outbreak from almost a decade ago was this Vibrio parahemolyticus outbreak in oysters that were harvested in northwestern waters that had never previously been infected with Vibrio, but now are at risk of Vibrio. And the other thing I probably could have added to this slide, we know very well the association between elevated sea surface temperature is actually cholera. And so the risk with cholera outbreaks because of increased sea surface temperatures. This is also new to me as an infectious disease person, is that elevated water temperatures may lead to higher concentration of methylmercury. All we need to know about methylmercury is we don't want any of it, especially in our little kids. So lots of reasons why you would see increased methylmercury within our water supplies, and this was also new to me. And I need to thank Scott for this. Scott Holmes from Lincoln Lancaster. Is Scott here? I thought Scott was going to be here. For this slide, I did not know this, which is that Nebraska fish consumption advisories in 2013 were primarily due to mercury contamination. Am I the only person? Some other people must have known this in this audience. No, okay. New to me. I didn't know that. So again, this is close to home. This is not happening in Alaska or happening in Africa somewhere. This is here and now. Food-borne and water-borne diseases and nutrition issues is another climate change and health factor. And this is pretty intuitive. So certain infectious diseases, mainly bacterial diseases of food, we see seasonality in them. So in my old job, we used to joke that if it was summer, we're going to start seeing all the Salmonella and Shigella outbreaks, because that's when they happen. They tend to happen in the summers. And so all you have to do is sort of magnify that and think about, what would happen if we sort of warmed up the whole world 5 degrees, put the whole world under a little pan and said, here, go up 5, 10 degrees. Well, what you're going to see is you're going to see an increase in these types of foodborne diseases. I love this number. Salmonella on raw chicken will double every hour at 70 degrees. And every 30 minutes at 80 degrees. And at 90 degrees, it only takes 20 minutes to double the amount of salmonella on your chicken. So these are some of the diseases we know are influenced by warm, humid conditions. This is a good place to mention the leading cause of foodborne disease, which is actually viral. It's Norwalk disease. It's not on this slide, and the reason it's not on this slide is we have data that says warm, moist conditions actually will decrease the amount of Norwalk that we see. So again, you can't just throw out you're going to see increased foodborne illness. You really need to look at the data and sort of de-aggregate it and say, you know what we're going to see is increase of this, and we're likely going to see a decrease of this. And that's our responsibility as scientists to really make that clear and not try to lump everything together and say the sky is falling, we're going to have increased whatever, infectious diseases, whatever. There's also an impact on nutrition. There's actually a number of different ways we affect nutrition. So carbon dioxide will likely increase carbohydrate content in food, but at the same time, I have learned that there's something called a carbon-nitrogen balance model for how plants grow. And so more carbon, less nitrogen, less protein within these plants, and especially sorghum and barley, and soybeans, etc., would have less protein content, which then obviously would have potential effects on our nutrition and health security. Also can have some difference in micronutrients within these products. And then finally, going back to some of the sea-related changes, climate change can alter fish distributions and productivity. So as we think about aquaculture, there could be impacts on the amount of food we get from the sea because of what's going on in the sea. Oh, I talked about vectors previously, but vectors doesn't just apply to our vectors, it also applies to pests on animal and plants. And so we should expect that animal and plant pests will also change their distribution. And as they change their distribution, we should expect that we will be using different pesticides and different types of pesticides on plants and with animals to try to keep them safe from whatever their pests happen to be. And then that likely may increase your exposure to chemical contaminants. The last element of food security goes to extreme weather events, where extreme weather events can obviously contaminate groundwater, can contaminate surface water, and then I had the opportunity to respond to Hurricane Katrina, where all of a sudden the water is now filled with oil, pesticides, heavy metals, and all sorts of other things because of an extreme weather event. And also extreme weather events can just disrupt transportation and other systems, so you can't get food also. Okay, let's come to the last one on my list, and that's mental health. That was a tour de force. That was pretty fast to go through all these various diseases, but I know you're listening pretty fast, too. So, mental health consequences of exposure to disasters. You can see examples here of various conditions that may be linked to disasters. Again, high-risk groups. And this is another part of our responsibility as scientists, is to say not just what disease, as you do an assessment of what the diseases are, but who's most likely to bear the burden of those diseases, depending on what's going on. Now, this was a nice graph that has not yet been approved for use. It's in a draft of a climate health assessment, but I'm using it because it's a nice example that you need to think about not just medical and physical health due to climate impacts, but also mental health, and at the end of the day, you need to think about community health and what is the effect of climate on each one of these factors. This probably resonates with everybody. How many people are more irritable the hotter it is outside? Yeah, I think that's pretty well shown at this point. And it's actually now it's data-driven that increasing temperature can increase the risk of personal violence and social upheaval. Here in the United States, I don't show additional data, but if I was doing this talk for a global audience, I would talk about global migration issues, conflict issues in many countries. As all your water dries up in country X, guess what you're going to do? You're going to go to country Y, right? And then think about what those impacts would look like at a global level. Not going to happen, obviously, here in the United States. But there, even though we may be the second largest emitter of carbon in the world, the countries that will bear the brunt of this climate change will be those who emit little to no carbon at all. So it's a really unfortunate dichotomy there. So I talked about the science to begin my talk. So let me end with the moral and social imperative to do something about climate change. This is, if nothing else, a reminder that our esteemed Pope actually has a degree in chemistry and worked as a chemical engineer. So he has more scientific background than most people to talk about the impact of climate on our communities. So talked about sort of the case for climate change, what the health impacts are, and let me end you here to think about what should we be doing? What should we be thinking about here in Omaha, Lincoln, the rest of the state, to help be ready for climate change? So there's a couple of things we need to be doing, and it really has to do with having a sort of a climate and health adaptation plan as part of what we're doing at the state and local level. So we, in city plans, state plans, we do this all the time. There is ongoing process for city planning for various things. And while they do have plans for natural disasters and pandemics and other events, climate is no different. And I hope I've sort of shown you that it just needs to be something we need to be thinking about is how are you prepared for the likely changes we're going to see in climate change? What is that burden going to look like? And then what are the public health interventions that you need to do? To make this happen, we need to make sure that we have a really good sense of what's going on in our community. And that means improved surveillance and disease detection and monitoring systems within our communities, because you can't, I love people talking about I've always used rapidly detect and respond. We love that phrase. However, if you're not looking for something, you can't do the rapidly respond part, right? So the first part is always look for it so you can find it, and that's about having these detection systems in place and improving our infrastructure here for vector-borne diseases. So we have, over the last 20 to 30 years, made entomologists. Before West Nile, we essentially made entomologists an extinct species in the United States. Right? The dengue was gone, yellow fever was gone. Why the heck were we worried about vector-borne diseases? Obviously, we're in a different state now, but we need to make sure that we are thinking long-term about what our needs are, and we have the right people doing that work. This comes from the Lancet, a set of recommendations that the Lancet put out a couple of weeks ago about what we need to be doing, modeling and long-term ecologic and epidemiologic research. Obviously, I talked about preparedness, which is big for me, that we really do need to prepare our community, and then being here as a medical center and a university center, thinking about what the training and education needs need to be for our workforce. So yes, we have brilliant trained clinicians here, but are they going to be thinking about the vector-borne diseases that never happen in Nebraska? Well, now they may need to be thinking about those, right? They're like, okay, patterns are changing. I need to be thinking about Lyme or whatever it may be, and I need to make sure what the right way to treat these conditions may be. Don't usually take care of heat stroke or whatever, in December. And then a lot of these issues have more to do with mitigation strategies than adaptation strategies, and what is the role of public health to think about how do we make that decision. Do we want 2 to 4 degree change, or would we like 8 to 10 degree change by the end of the century? And what does that take in terms of renewable energy and other transitions to low carbon economies? So this is the challenge that we have in this state, and I think why we have 8 roundtables to work on climate change is, and this is a constant challenge, it is hard to communicate uncertainty. Not uncertainty that climate change is happening, the data is pretty clear, not uncertainty of why it's happening, but the uncertainty of, Tuesday, October the 7th, you will get West Nile. Can't do that for you. I'm sorry. The data just isn't structured that way. And so how do you help people understand that, yes, you're at risk of salmonella, but wait, you're not at risk of NOAC? So it is complex. And how do you communicate that complexity as you're trying to have people make changes within their communities to mitigate carbon and then the warming, and then to make the appropriate adaptation changes. I do think that we need to frame public health as frame climate change as a public health issue. As I said, yes, there's social, economic, political, ecologic impacts, but at the end of the day, it's a health issue. And I told this joke earlier today, a burning building is a disaster. Pop 2 people in that becomes a crisis, right? Okay, that's why climate change matters, because at the end of the day, it's about the impacts on humans and human health impacts that we care. Otherwise, it's just warmer. The costs of not taking action are quite high, and linking meteorologic science with health means we need to be thinking differently. And this is why I'm so grateful for our colleagues in UNL and across the University of Nebraska system, because we really need to be thinking in a multidisciplinary fashion about how do you weave these pieces together to think about what's the science and what we should be doing here within our communities to protect us. And what is that new science? What does that look like? I'm not usually used to chatting with meteorologists. That's just not my day job. But maybe it needs to become, for many of us, our day job is to find those meteorologists and say, hey, what does this mean? What is the impact likely to be? And I will leave you with this slide. Thank you, everybody. I will be glad to take questions and comments, easy ones first, and then we can get to the harder ones later.
Are there questions?
I think it was your first or second slide. You had South Carolina floods. Is the 6,000-year flood since the year 2010 or
The South Carolina, it's been characterized as a 1,000-year flood, which doesn't mean that it occurs every 1,000 years, but that there was a 0.1% probability of the nature of that flood. And I think it was very tragic. There's like a number of people who died as a function of that flood. So that was the point. A low probability event that we're seeing. And any individual event, it's hard to point a finger at it and say, you are due to climate change. But when you add them all together, as I did in a subsequent slide, and you see what's happening with natural disasters due to extreme weather events, that's more compelling to say the data is pretty clear that we're seeing an increase over time.
I was a little mixed up about the relationship between mercury and climate change.
Oh, good. So was I. So let's go back. I started off by saying, as a public health person, this was new to me. So I'm going to ask for our environmental health experts here to bail me out on how the heck mercury makes its way from plants and agriculture into this. I guess here's the slide, right? How does mercury make its way from industry and other places into water? How that gets picked up and makes its way up the food chain to you.
That's what I was wondering how
Increased runoff. No, rain and increased runoff. It's extreme weather events. Precipitation and increased runoff is the main component. Are there any others that I need to mention?
Is that what has Nebraska seen increased? I didn't get from the presentation. Are we in a drought or are we in a wet?
The answer is yes, depending on where you are in Nebraska. So the answer is yes. And then obviously here in Nebraska, we see that there are issues of mercury contamination within our own waters, leading to fish consumption advisories.
We're seeing heavy precipitation.
Not everywhere. Right?
Certainly in the eastern part of the Great Plains and through the Midwest, but actually nationwide, we're seeing a significant increase in high intensity rainfall events. And so that means more sort of flash flooding, higher flood magnitudes, and so on, and also flushing of pesticides and other things from the soil into our water sources.
I don't want to make anybody seize, but I think that was it there. Here you go. Observed changes in very heavy precipitation. So that's what we're seeing here in the U.S. right now. Yes, please.
Is it true that cold
Is coal the major source of mercury? Ask now. I've got a lot of help now. I'm feeling good about these questions. Got Alan back there. I got lots of help. Go ahead.
This is a great presentation. Thank you. However, as you all, this panoply of negative health effects, I hope it does turn into an action plan for Nebraska, and the rest of the roundtable is successful as well. But let's say Nebraska comes up with a climate action plan. That won't really do us any good if Iowa doesn't have one, and Kansas doesn't have one, and Colorado doesn't have one. Because these tracks don't stop at borders, state borders and international borders. So what can Nebraska do, not only to implement its own action plan, but to persuade the rest of the states across the country that they need to implement an action plan, or hold them accountable if they don't?
So that's a really brilliant question. So we see cross-border activities around climate change. California is the best example. California is working with its neighbors to think about climate change. I'm personally unaware, and unless we have somebody here at the state government who can help us to say what are the local compacts here with Iowa, Missouri, et cetera, to think about climate change. Your point's well taken. I heard a great lecture a couple of days ago about climate change where, based on how people burn grasslands in Missouri and land, in Kansas, how you get bad weather days in Lincoln all of a sudden. So you're right. We are subject to the conditions around us, and we need to work collectively with that. The feds do help us here because this year I was kind of surprised. The Congress put an extra $10 million into CDC's budget for climate change, and so they're increasingly funding cities and states to develop these health and climate impact plans. So they're helping sort of do that by getting more money out to city and states to think about what they need to do.
On the heels of that one, I'm glad to see that enhanced surveillance is something that I guess I'm a little confused. The Lancet proposed several action items. Is that something that this college is also saying about?
Oh, absolutely.
And then regarding the enhanced surveillance system, for several years the CDC has been promoting environmental health public practice system, and which has been adopted by Iowa, Missouri, Kansas, and Colorado. And Nebraska hasn't, as far as I know, hasn't been pursuing that. Is the college going to take steps, or is maybe you don't like what PhD?
No, I do, and I interacted with it back in my old days. I think we need to find out the right way to how to make this happen here. And I'm going to look at our wonderful chair of environmental health to say we'll follow up on on the environmental health tracking system. I think they usually run out of state and local health departments, aren't they, for the state health department? At the state level, at least. So they may need help, but, it's something to follow up with the next time I have a chat with their CEO.
Just in response, 34 states already have climate change plans. We're not one of them.
Right.
Down the middle from North Dakota down to Texas, none of those states.
And it's not expensive. So, we spend a lot of time thinking about, people talk about, the billions, trillions of dollars potentially around mitigation issues, but adaptation issues, setting up climate response plans, that doesn't take a whole lot of money to bring those sectors together, because they're already planning for other things, to bring them together and say, how do you plan for this?
If I could follow up with that, though, it's not the cost of putting it together or the sectors working together. It's the political toxicity of the term climate change. They might say we have an improved public health plan, but they can't admit that climate change is the reason. The governor of Florida has outlawed all political employees in the state, all state employees from dealing with the issue of climate change, referring to it in public in any way. The state of South Carolina outlawed climate change, consideration of building shoreline infrastructure and housing and so on. They can't consider it. So they just made it illegal to consider it. Governor Scott Walker of Wisconsin done the same thing. They can't talk about climate change. All that has to do with the political thing. And there's a real political toxicity in dealing with this issue in half of the country's political establishment. How do we get over that hurdle?
Darn good question. Okay.
There's a real simple answer to that. That's to listen to Dr. James Hansen, godfather of climate change. Real quickly, the plan is to create political will in this country to tax carbon and give all of that money back to the people. We start out with a small tax and then increase it every year until we stop using carbon, basically. And we also have border adjustments, so when countries or industries from other countries bring their products here that don't have this tax, equalize the value of their products to ours. This would create 2.1 million new jobs in 20 years, and if we keep increasing the price of fossil fuels, we'll get rid of it very quickly. So that's the political answer, and this group has been going to Washington for 7 years now, and doubling in size every year since it started. And we need Republicans like the 11 that just came out and said, yeah, climate change is real and they're part of it. We need more Republicans like those 11.
So we're really helped by our own data. I mean, I got to give kudos to you and to the rest of the team who put this report together that says this is what's happening in Nebraska. Okay, I think we're really helped by that. So this isn't somebody in New York City or Paris coming and telling you that climate change is happening. This is what's specifically happening within our state and with the health effect and the concomitant health effects that are occurring within state. So, you know, the governor of Florida may have outlawed climate change, which is an interesting approach to make a global condition go away. Just outlaw it. But the governor of Florida still has dengue that's reestablished itself in Key West after almost 60 or 70 years. He says chikungunya that's reestablished itself in southern Florida after 150 years. Okay, so you can't outlaw the diseases and tell them, sorry, you know, you don't exist anymore. You can outlaw terms. And I think in the end, science will prevail. And, you know, we do have 34 states that have climate response plans. So it's going in absolutely the right direction.
There's good news. Many of you will already have heard that this year's Nebraska rural poll done at UNL every year shows that 61% of rural Nebraskans favor a climate action plan. We see a lot of opinion polls and other indications that people do care and they generally get it. They don't always have something in mind that they should do right now. I make presentations to people, including in rural Nebraska, too, in the last month. And when you get to the slide about what happened to the groundwater levels after the 1 year of 2012 drought and heat, and you ask them to imagine what that's going to be like when it's 3, 5, 7 years in a row, the room goes dead silent. Every farmer and farm-related person in that room instantly gets it. So my point is that we have a tremendous reservoir of potential in Nebraska. And there's this huge chasm between what the people know and what the people want and what the political system has to deliver. And the political right wing loves to bully people and try to prevent you from talking about climate change. We just can't put up with that crap anymore.
I like the part about the huge chasm. I don't think we give the people in Nebraska enough credit. So I've now had the chance to go across the state, and when I go to farmers and they have their app for what's going on with the temperature minute to minute, and they have GPS within their tractors that's going around and around, and they are not anti-science. They understand science, they understand technology, and we need to give them credit that if you're a farmer, climate change matters to you in this state.
We know that rural Nebraska is a target for the effects of climate change, including public health issues, not as urban areas. So I'm wondering how UNSC is going to work with the local health departments across Nebraska, what that future relationship is going to look like on some of the goals, like the lamps that have put out, for example. So how is the rural Nebraska public health department going to work on targeting what new diseases are coming into the communities, and how can we strengthen that with what we have here?
I That's a great question, and it's not just rural Nebraska. I think it's across the state. I think even urban Nebraska, we need to look at what cities planning looks like and what they're putting together in terms of their climate response plans. But most of these, now I've had the advantage now of a year of being here. Most of our rural health departments usually have somebody that does preparedness-related work, and that's just a function of the way CDC sends money down. And it's always been my belief that if you do preparedness-related work, so if you're worried about anthrax, for example, or smallpox, I want you to be worried about climate change and think about what those implications are. They're already, as part of that planning, they're already putting together the right coalitions already. They just need to broaden them and think more about, okay, what vectors should I be worried about in this community? Should I worry, heat waves, et cetera? Are we mapping the vulnerable population within our community so we can identify them in the event of something happening? Not yet. I think I'm hopeful that as the grant gets rewritten, climate change will be explicit within those grants. It's not yet. And that'll also allow more money to flow for that specific reason.
Talk a little bit about the need for training and education in respect to the public health workforce. Can you talk a little bit more about how that's finding its way into the curriculum?
Great question. So it's not just it's the public health workforce that's already out there, but it's our public health students, it's our medical students, it's our nursing students, it's our PT, and it's our OTs and everybody else that we train here within the medical center for them to think about climate change. And again, this isn't new diseases, right? So what it really requires, and as the curriculums are being updated, what it really requires is when somebody's teaching you Lyme, West Nile, et cetera, to say, you know what, these we don't worry about yet, but maybe these you really need to start worrying about as you're out in the community and you see somebody with a rash and a fever at a certain time. The same thing about heat strokes. This is not something we worry about here, but maybe you now need to be worrying about this and make sure you understand how you would treat that. So you're right. It does need to become part of our curriculum.
The training and education, I love it that it's the public health workforce and it's all those who have hands-on. Occupational health is also a public health issue. And so I wonder if isn't there an opportunity to integrate climate change best behavior activities with wellness programs, and try to infiltrate that into the workplace?
Good thought. I don't think we should ever forget occupational health, especially since my chair deals with occupational health all the time and is staring at me. All right. We'll take another one, maybe two, and be...
Just to piggyback off the first question, I just got to thinking, since it's such a toxic word, I guess, climate change or phrase, and since the public health, you're only looking maybe 10 years down the road, and that wouldn't really be climate change anyway, that would be more of, because climate change has to be hundreds of years, right?
No.
Well, I mean, for it to really change, right? It won't change with year to year.
Of course it's been changing from year to year. You have the data that shows it's changing.
Anticipate, like, next year, how climate change will affect Nebraska? Or, like, what I'm asking is, would it be possible to just rename it?
So it's no longer global warming. It's climate change. I use climate disruption. What would you like to call it?
I'm saying
that would make people happier.
Plan, right? Because we're already monitoring infectious disease anyway, right? So if we need to start anticipating, like you said, Lyme disease, and it's critical that we do that so people don't fall ill, and it's so toxic to call it a climate plan, is there a way to just call it something else and do it? Monitor for weather, seasonal changes, or whatever you want to call it. In the public health's interest, just to get that plan out there, but
Well, I mean, we're doing a lot of that. So the climate is changing. It's changing dramatically. It's changing more in some locations than others, more rapidly. One of the scary things about climate change is there's enough that we don't understand about the interactions between the ocean, land surface, and so forth, the atmosphere. In terms of tipping points, for example, about half of the carbon dioxide that we've put into the atmosphere so far experience of permafrost in the Arctic region in terms of release of methane into the atmosphere. Huge quantities of methane, which is a more potent greenhouse gas than carbon dioxide. So it's some of those things that we don't understand that could exponentially change climate in terms of the rate of change in the future. I mean, we're monitoring all kinds of things, and we're modifying, we're adapting to the changes that are occurring now in all kinds of different sectors. That's just happening. But to sort of tag climate change on this and where we're headed with this, I think is a new challenge. We think about where we're going to be in 20 years, and 40 years, 60 years, and so on. That's where it gets really.
And that gets to my earlier point about uncertainty. Okay, you get the one last question.
So I was really excited that you mentioned multidisciplinary engagement with meteorologists. And since a lot of the diseases we focus on have animal reservoirs, I was wondering how you envision UNMC engaging with domestic animal and wildlife disease surveillance or stakeholders.
So this goes back to One Health issues. Yes, I noticed you bouncing up and down. So you're right. And I'm not sure if I should just start calling it planetary health issues. You're correct. Infectious diseases in general require a different approach than we've taken, which is just focusing on the human side of the house. We need to think about the environment side of the house, climate change being part of that environment, and we need to think about the animal side of the house. We're starting some additional work with the UNL around in their animal science program, and then reaching out to some colleagues in Kansas who have some more veterinary experience. But, given the fact that we treat Ebola right across the street here, we will be increasingly engaged in emerging infectious diseases. And if you think about local, national, and global strategies, those have to be One Health strategies. Last word?
I don't have a last word other than thank you very much.
Thank you,
for the
everyone.
lecture.